ours going?
Oh my god, I don't know. Let me text him.
Right, look at this.
Oh
my god! Oh my god!
No allergies?
No.
Okay, good. Do you feel like you're bleeding anywhere?
I can't feel it.
How about your tummy? Do you feel anything here?
No.
How about here on the other side?
No.
Put in. Got a pretty significant head injury. Let's get Lieutenant, can you see if airlift's flying? Pupils are slow. Does anybody know her? Does anybody know her?
I'll move her shoulders. Okay, so what we're gonna do is he's gonna hold your neck to tell you not to move. I'm gonna move your shoulders over a little bit, and then we're gonna slide you up onto the board, okay? If it hurts at all, you gotta let me know, okay? We're just gonna move you. Okay, right there. And I'm gonna slide you. Ready? Yep. Okay, hold again. Ready? 1, 2, 3. Hold the seat going.
Nice and slow, nice and slow.
Who's taking report?
Right here.
Hi, 17-year-old female, unrestrained, back seat. She's got head, neck pain. She's got reduced motor sensory circulation in her upper extremities and almost none in her lower extremities.
Okay, let's go.
Bilateral. Looks like a high. Otherwise, vitals are stable. Motor sensory circulation.
A cervical spine fracture is caused by axial loading, forced extension, flexion, or lateral flexion of the neck. On the site of the cervical spine fracture, treatment would consist of inline stabilization or traction, usually with a C-spine collar. An extreme caution must be taken. Upon arrival at the hospital, the patient will almost immediately undergo surgery, and in this case, a cervical spine fusion was performed.
18-year-old female, possible ejection, found down, unconscious, unresponsive. Right over here. Pupils are very slow to react. She's bradycardic. Definitely has a head injury and negative on secondary assessment. We're ready.
Ready?
Yep.
3, 1, 2, 3.
She's got an IV established. She's had 1,000 cc's. It's her second bag.
An epidural hematoma is tearing of the meningeal arteries, which is usually caused by a blow to the head or a skull fracture. The most obvious sign of an epidural hematoma is loss of consciousness. Oftentimes, an epidural hematoma is fatal. Treatment would consist of a CT scan, which would be followed by surgery to relieve pressure on the brain. This would consist of burr holes being drilled into the skull to allow some blood and fluid surrounding the brain to leak out. Treatment of whiplash will include RICE: rest, ice, compression, and elevation of the neck. After ice, heat will follow, and a cervical collar may help relax the muscles of the neck.
Okay, there you go. This is gonna feel kind of weird, just so you know.
Cervical sprain, otherwise known as whiplash, is caused by rapid acceleration and deceleration forces, causing the neck to hyperextend and hyperflex, or by lateral hyperflexion.
Pressure is normal. Give me just a second to write that down. So, the EMTs told me that you're having some trouble with your neck. What's going on? What do you feel?
My shoulders, behind my shoulders hurts.
Okay. I'm not going to move you just in case you have a C-spine fracture.
Signs and symptoms of whiplash include localized pain, point tenderness, muscle guarding and spasm, numbness, tingling, and the symptoms will persist longer with whiplash than they would with strain.
Take a deep breath. Take a deep breath.
A zygomatic fracture or a cheekbone fracture is caused by a direct blow to the cheekbone. Signs and symptoms of a zygomatic fracture include obvious deformity, epistaxis or nosebleed, diplopia, otherwise known as double vision, and numbness in the cheeks. Treatment of a zygomatic fracture will include the application of an ice pack, an immediate referral to the doctor for x-rays and to see how severe the fracture is, and it should take 6 to 8 weeks to heal.
Hi, how are you today? Good.
Okay, I'm gonna check and see if your pupils are dilating properly. A subdural hematoma is tearing of the vessels bridging the dura mater and the brain. Much like an epidural hematoma, a subdural hematoma is usually fatal. The most you can do for someone suffering from a subdural hematoma is to make sure that their airway is open and that you call 911. A subdural hematoma is caused by rapid acceleration and deceleration forces, causing the brain to be slammed anteriorly and posteriorly in the skull. A nasal fracture is caused by a head-on blow to the nose or a side blow to the nose, which causes greater damage. Signs and symptoms of a nasal fracture consist of profuse bleeding, swelling, which is immediate, deformity, and congestion. Palpation may reveal an abnormal ability to move the nose. To treat a nasal fracture, you will first need to control the bleeding. Make sure that the patient puts ice on their nose to lower the inflammation, and make sure that they don't blow their nose for approximately 24 to 48 hours after the injury to prevent further hemorrhaging. Refer them to a doctor for x-rays and possible resetting of the bone. They can return to their daily life immediately after the injury, but it should be known that the nose must be adequately protected after the injury to prevent further damage. An orbital hematoma, otherwise known as a black eye, is caused by a direct blow to the eye and is also a symptom of a nasal fracture. Signs and symptoms of an orbital hematoma consist of bleeding in the eye, faulty vision, watering of the eye, and swelling. Treatment of an orbital hematoma would consist of an ice application, 5 minutes on and 5 minutes off, a 24-hour rest period, and you should sustain from blowing your nose for the first 24 hours after the injury to prevent further hemorrhaging.
5 minutes on and 5 minutes off, and don't blow your nose for the next 24 hours so that you stop hemorrhaging.
A dislocated tooth is caused by a direct hit to the mouth. The symptoms of a dislocated tooth are bleeding, swelling, and the tooth coming out of the socket. A dislodged tooth can be kept in water for up to 30 minutes. Epistaxis is commonly known as a nosebleed. It is caused by a direct blow to the nose or dehydration.
First thing I'm going to do is see if your pupils are dilating. Okay, there. Now, do you know what your name is?
Yes, Abby, duh.
Do you know where you are?
Yes, the hospital.
Do you know what the day is?
In order to treat epistaxis, you should put latex gloves on, sit the athlete upright, and put a cotton plug up their nose. Apply a cold compress over the nose. Ask the patient to apply pressure over their affected nostril for 5 minutes. The athlete should not blow their nose for 2 hours after the injury to prevent further hemorrhaging.
And keep ice on your nose, 5 minutes on, 5 minutes off, and don't blow your nose for 24 hours.
Okay.
A law enforcement officer is going to want to speak with you now.
What?
Hi, I'm Officer Zeman. Are you the driver of the second car?
Yeah.
You want to tell me what happened?
I don't really know. I was on my phone and next thing I knew, there was an accident.
Okay. You understand that people were injured badly? In
Yeah.
that accident? Yeah. What's your name?
Abby?
Abby? You don't seem to really care at this point.
Well, I do.
You do?
Yeah.
You don't seem to. Well, guess what? At this point, you're under arrest for vehicular assault investigation. So I need you to stand up, turn around. And how old are you, Abby?
I'm 18.
18. Well, this time you get to go to regular jail. You don't get to go to juvie. All right, let's go.
Secondary impact syndrome happens when an athlete receives a second head injury before the symptoms of the first head injury, typically a concussion, are gone. Signs of secondary impact syndrome are that the person may appear stunned. Within 15 seconds after they're hit, they collapse, their pupils fully dilate, they lose their ability to move their eyes, and they experience respiratory failure. Unfortunately, secondary impact syndrome is usually fatal. The most that you could do is call 911 and make sure they have an open airway.
Are you Lauren's family?
Yes.
I'm really sorry, but we did everything we could. After the car accident, she had an epidural hematoma, and she went into cardiac arrest. We tried to save her, but there was nothing more we could do.
No, there has to be more. There's got to be something more you can do.
We did everything we could do.
No.
She's too far gone.
No, that's not the answer. You have to go back in there and you have to do something about
The
this.
surgeons did all they could.
No, this.
I'm sorry.
No, I can't accept that. That's just not okay.
You can take all the time you need.